Hello? Did you know that I'm now officially a full-term baby? That means even if I were born today, no doctor would call me premature. My lungs are almost fully developed. My immune system is getting stronger thanks to the antibodies from my mom. My sucking reflex is in full swing, and I'm ready and waiting for birth. So what's happening this week? What changes are taking place in my mom's body? What tests are being done, and what should you watch out for? Let's dive into the details of week 37 together. I'm now about 47 to 49 centimeters, 18.5 to 19.3 inches, long and weigh between 2,900 to 3,100 grams, 6.4 to 6.8 pounds. So I'm about the size of a romaine lettuce. Space is getting tight in here, so I can't kick like I used to, but I'm still very active. I turn, stretch, hiccup, and even suck my thumb. I'm strengthening my jaw and sucking muscles, practicing hard so I can feed from my mom once I'm born. When I'm asleep, my eyes stay closed, and when I'm awake, they open. Sometimes my facial expressions change too. I might frown or even appear to smile. But don't get too excited. It's all reflex for now. My motor skills have improved so much that I can grasp my toes or even my nose. Everything I do inside the womb is like a little rehearsal for what I'll do after birth. My lungs are mostly developed, so if I were born today, I'd probably be able to breathe without help. My immune system is still maturing, but after birth, I'll get an extra boost from my mom's colostrum and breast milk. This week, doctors are observing me very closely. They'll check my size, weight, the amount of amniotic fluid, heart rate, and blood flow using ultrasound. I'll also be connected to an NST, or non-stress test, for about 20 minutes to monitor my heartbeat, movements, and any contractions in my mom's uterus. If my mom has any chronic conditions, related tests might be repeated as well. My mom's body is on full alert, preparing for labor. At this stage, she might be dealing with the following: swelling, which could mean mild swelling in her feet, hands, or even nose. And then there's nausea. Not like in the first trimester, but it might come back a little. Heartburn can occur because, as I grow, I put pressure on her stomach, which can cause acid to rise into the esophagus. Sleep issues might also be a challenge. It could be hard to get comfortable at night. Bladder pressure, back pain, cramps, or contractions can interrupt her sleep. Braxton Hicks contractions. These are irregular practice contractions, not to be confused with real labor. If they become regular and intense, it's time to call the doctor. Pelvic pain. As I settle into the birth canal, she may feel pressure or pain in her pelvic area. She might also notice some yellowish fluid leaking from her breasts. That's colostrum, the first milk, showing her body is getting ready for birth. Diarrhea. If it's not pregnancy-related, it could be a stomach infection. Best to consult a doctor. Decreased movement. This can be a concern. Because I have less space, my movements may feel more like rolling than kicking. But if there's a noticeable drop in activity, it's important to check in with the doctor. Cat litter. If my mom has a cat, she should avoid cleaning the litter box due to the risk of toxoplasmosis. Chemicals. She should stay away from harsh chemicals like bleach during cleaning. If my mom is feeling too warm, here are a few simple ways she can cool down. Place a chilled gel mask from the fridge over her eyes. Rinse her hands and wrists with cold water. Use a cooling spray or a small fan. Drink plenty of water. This week, what I loved most was snuggling into a cozy position and falling asleep in my mom's belly at night. Yes, I still move around, but I've learned to keep to a schedule. My mom even knows when I'm awake and when I'm sleeping. And you, my dear mom, what did you love the most this week? Tell me in the comments. If you found this video helpful, I'm so glad. Just like every week, we've taken another scientific and emotional step together. Don't forget to like the video, subscribe to our channel, and share your experiences this week in the comments. See you next time in week 38. If you're ready, just a few more weeks to go. The countdown has begun.